followed by Dr. Alex Jahangir, Chair of the Coronavirus Task Force and Chair of the Metro Board of Health. We'll also hear from Dr. James Hildreth, President and CEO of Meharry Medical College, and Andrew Clancey, founder and designer of Any Old Iron, and Tasha Kennard, Executive Director of the Nashville's Farmers Market. Also joining us today to help answer your questions are Dr. Adrian Battle, Director of Metro Nashville Public Schools, Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department. We'll now begin with Mayor John Cooper.
Good morning, Nashville, and thank you for joining us today as we share our latest information on COVID in our city. This morning, our key metrics have not changed. 3 are red and 2 are yellow. Our rolling 14-day average of new cases is now 221. It hasn't been this high since late July. And our new cases per 100,000 residents is also climbing. It's at 35.5. That number shows that Nashville, like the rest of the country, is back to the levels from the late June and July spike. And we must once again flatten the curve, and that means masks and social distancing. Where are these new cases coming from? It's a question we are all asking. And in short, we're seeing the virus come from many, many areas. Anytime people are breathing on each other creates risk. Now take a look at this chart. New cases are due to widespread community transmission. Of the 5,002 cases reported so far this month, the team at Metro Health has provided the following analysis from their case investigations. 6 out of 10 people are getting the virus from their work or at home. 31% of cases are coming from the workplace. Work transmission can happen when coworkers aren't wearing masks, when in a meeting or unloading a truck together. Anytime you're sharing air, there is a risk. At 30%, household transmission has been an equally common way of spreading the virus. We can unintentionally expose our family members at the dinner table or watching a movie on the couch. As we move into the holiday season, this is especially important. Being casual and not wearing a mask this weekend with your friends can put your older family members at risk later. Now next is travel. And that accounts for 13% of the October cases. And here we're talking about attending an out-of-state wedding or visiting friends at the beach. As we've seen all too often with tourists coming into our own city, it's easy to feel like the rules don't apply when you're on vacation. And people can easily pick up the virus while with friends on a trip and bring it back home to their family, friends, and coworkers. Spread comes not necessarily from travel itself, but from being too relaxed at the destination. Now then we have social contacts at 12%, including backyard cookouts, birthday parties, bars, restaurants, and gyms. In October, we've seen a cluster traced to a karaoke bar and our first cluster linked to a gym. Now finally, we see university spread at just under 6% and K through 12 childcare at 6%. The spread in students at universities and in schools has mostly been from sports, parties, and gatherings, with a minimal spread within a classroom setting. Now the virus is spreading anywhere people are breathing on each other and not being vigilant. That's why we can't let our guard down. Keep your masks on when you're talking to coworkers, catching up with friends, visiting your grandmother, or hosting a Halloween costume competition. Now, Nashville is not alone in this. There are no safe zones where the virus is not a threat. Every county in our state and in states across the country, cases are spiking. Now, I want us to remember what we know, what works, and we've gone through it before. We've got to get through the winter, and masks and distancing are our best tools, but we must use them. 80% compliance is required for masks to be effective, and we can't take them off just when we get comfortable. We have to flatten our curve again so that hospitals have capacity to treat those severely affected by this virus. Now, this week, Vanderbilt Health Policy issued a report showing that hospitals serving areas without a mask are seeing the highest increases in hospitalizations. And I want to thank the mayors of Rutherford, Williamson, Wilson, Sumner, and Montgomery counties, who each reinstated mask mandates within the past week. Similar to when we instituted our mask mandate, it will take about 2 weeks, one life cycle of the virus, to see the effect of their mask orders. Without a statewide mask mandate, county by county, we are stepping up and masking up. It will take a broad approach, and 1 or 2 counties cannot fight this pandemic alone. Now, our economy is deeply affected by spending patterns changed by the coronavirus. The Vanderbilt report also analyzes how consumer behavior has reacted to the spread of the virus. And Vanderbilt Health Policy researchers used cell phone data to show that the economy activity decreases when case numbers go up. The report got national attention because it shows the impact that mask wearing has on hospitalizations and the link between case numbers and the economy. To summarize, the best way we can help restaurants and other small businesses is to get our case numbers down. Wearing masks and social distancing saves lives and saves jobs. This Halloween weekend, please remember to wear a mask and stay socially distanced. The scariest thing about Halloween 2020 is still COVID-19. Remember, even friends who have tried to be safe can unintentionally spread the virus, and you do not want to spread the virus to your friends and family. Wear masks for yourself, for your neighbors, and for the health of Nashville's economy. Now, I'm happy to have Andrew Clancey and Tasha Kennard join us today. Andrew is founder and designer of Any Old Iron, a local fashion boutique, and Tasha is executive director of the Nashville Farmers Market. They'll share a bit about how they've adopted to make people feel safe in their venues. And Dr. James Hildreth is here today, and I know we'll hear more from him on masks and his perspective on what our community needs to do to keep us all safe. We're also nearing Election Day on Tuesday. If you haven't already voted, your voice matters in our national discourse and in our democracy. I want to make sure you have information about your voting options. If you have an absentee ballot, after you fill it out, please take it to the post office at 901 Broadway. That way, you will ensure it will arrive in time. And finally, let's move to my favorite part of these weekly updates, Nashville's Community Hero of the Week. This week's featured neighbor is better known to his friends and fans on social media as Mr. Puckett. But today I'm calling him a hero. In addition to helping feed people who are experiencing homelessness, Mr. Puckett also delivers much-needed supplies to area schools. Mr. Puckett, I salute you. You are a fine example of what makes our city great. Thank you, Nashville, for spending your time again with us this morning, and I'd like to turn it over to Dr. Alex Shahanger, Chairman of the Metro Nashville Coronavirus Task Force. Alex?
Thank you, Mayor Cooper, and good morning. Here's the latest on coronavirus in Davidson County. Today, we have a total of 34,418 cases. That's 262 cases since yesterday. That makes our active case count at 2,411, which is up from last week at this point when we were at 1,920. The rolling 14-day average of new cases is 221. Last week, we were at 175. The new cases per 100,000 is at 35.5. Again, last week, we were at 28.2. Our transmission rate is the same as last week, still at 1.22. Even though our numbers are high, Davidson County still ranks 63rd out of 95 for disease activity in our state. 63rd. Back in July, we were one of the top for disease activity. Hospital bed capacity in Middle Tennessee currently is at 13%, and in Davidson County is at 6%. And ICU capacity is at 13% in Middle Tennessee and 12% for Davidson County. The number of individuals hospitalized in Nashville hospitals right now with COVID-19 is 199. This is the highest this number has been since July 23rd. Our 7-day positivity rate is 6.9%, again up from 6.1% last week. One milestone we've hit in Davidson County now is we have tested 509,000 individuals for COVID-19. I remember back in March when we were worried about finding swabs, and now we have tested 509,000 people. So our robust testing program has been a success in our response. This past week alone, we've tested 30,152 individuals. We're averaging a little over 4,100 a day. There have been 302 Nashvillians who have died because of this virus, for a mortality rate of 0.8%. But remember, for those individuals between 65 to 74 years of age, the mortality rate in our city is still 5%. And for those 75 to 84 years of age, the mortality rate is 12%. And again, if you are over 85 years old and you get this virus, 15% of individuals die. These numbers are not what we want, and we know what we need to do, however, to fight this. We all need to wear our masks, and we all need to stay out of crowds. Mask works, there's no doubt about it. I believe, as the mayor noted, study after study has shown that masks are effective, and most recently the Vanderbilt study, which has garnered so much well-deserved national attention, proves this point yet again. Medical experts have told us, Dr. Schaffner and Dr. Hildreth, who are two of the most well-respected individuals we have in this city, have been saying this. Masks work, but only if you wear them, so you must stay vigilant. The second thing is stay out of crowds. Now, the virus spreads due to close crowds, and ideally, being in a crowd of more than 10 people is more likely to expose you. So stay out of crowds of more than 10 people. You know, Halloween is right around the corner, and I, like most families, have been looking forward to this all year. But this year, we're going to do things a little bit different. A few extra precautions that the CDC have recommended, which makes trick-or-treating a little bit more different, but yet safer. You know, our kids, for instance, will be doing scavenger hunts, and we'll be doing something in a more closed environment or a smaller group with some family. So go ahead and just make these plans to avoid big crowds and still enjoy the Halloween holiday, but do it a little bit differently. And remember, traditional Halloween masks don't protect you against COVID. Facial masks and covering that we've been talking about for a while is what protects you. And finally, right now, get a flu shot. Flu shots are available. We need to get them, and it's more critical now than ever again, so we don't want an active flu season. So get one. One note about our assessment centers, which are open every day from 8 until 2. On Tuesday, November 3rd, Election Day, we will close our assessment sites to give everyone an opportunity to vote. There still will be opportunities to get tested in our city at our local health systems, but our assessment sites will be closed on November 3rd, but we'll open again on Wednesday, and we'll be open on Monday the 2nd. So Nashville, stay focused, wear your mask, stay out of crowds, and get your flu shot. I now turn it over to Dr. Hildreth. Thank you.
Good morning, Nashville. Fall is now upon us. Daylight saving time will end this weekend, marking the beginning of time when we spend much more time inside, where the likelihood of virus transmission is much higher than outside. And this is occurring at a time when the pandemic is surging to record numbers of infections and hospitalizations around the country. Indeed, just this past week, there was an astonishing 500,000 new infections. And unfortunately, as you've heard from the mayor and Dr. Jahangir, the metrics here in Nashville have taken a turn in the wrong direction. The results of a recent study published in one of the top medical journals help us to understand the magnitude of our current challenge. What these investigators did was they collected samples from 65,000 patients being treated at 1,300 dialysis centers around the country. They used a validated antibody test to determine the prevalence of antibody-positive individuals in our country. They then performed a sophisticated statistical analysis to extrapolate the overall prevalence of antibodies in the U.S. population. What their results showed is that 9.3% of us have been infected by the virus. If you take the data from the Johns Hopkins COVID tracking project, which tells us that about 830 of us have been diagnosed for COVID-19 per 100,000 individuals, if you divide those two numbers the prevalence of diagnosed cases by the number of people who have antibodies positive for COVID-19, it turns out that 90% of cases are not being diagnosed. I need to say that again. That 9 out of 10 people who get infected are not being diagnosed with COVID-19. What that means is that there are a lot of individuals out there who are positive, who are not aware of the fact that they're positive, and they are probably contributing to the significant spread of the virus. We all know now that pre-symptomatic and asymptomatic individuals can spread the virus, but what this recent data shows is that the magnitude of that effect may be way more than we could have suspected. That if 90% of us get infected and we don't know it, that means we can be driving the transmission and not being aware that we're doing so. So the high rate of asymptomatic infections makes it really imperative that as we spend more time inside with our family and friends, that we be vigilant about preventing the spread of the virus. So unless the persons you're interacting with have been part of your bubble, for example, my wife and I have our own little bubble, and when we're not interacting with anyone besides ourselves, we're going to be wearing masks to protect the individuals and ourselves from COVID-19. So, as you've heard from Dr. Jahangir, avoiding crowds is really essential, especially now knowing that 9 out of 10 people with this virus may not be aware that they have it. So, among all the other things we need to do, we certainly need to avoid crowds. And that's especially true if people in the crowd or in your group are at high risk for COVID-19, severe disease. And as a reminder, that includes persons who are 65 years or older, have chronic diseases like high blood pressure, asthma, heart disease, cancer, and especially if you have autoimmune diseases. You need to avoid getting the virus, which means that we need to protect you from getting the virus. So, as we move inside and interact with each other, please remember to keep your distance, wear the mask, and do the things that we need to do to keep us from getting infected. Now, Nashville, I know all of us are suffering from COVID-19 fatigue. We're weary of having our lives disrupted the way they've been. But here's the thing. We're fighting an incomplete life form that has one thing on its mind, or one thing it's programmed to do. That is to find someone to infect that person, and then move on to others and infect them. Despite not having a vaccine or a curative therapeutic drug, there are some things that we can do. There are some weapons we can use to fight the virus. Foremost among those weapons are these simple devices, which represent a mechanical barrier between you and the virus, or the person you're interacting with in the virus. So if we all do this, the data is very clear. We can considerably slow down the spread of the virus. We all need to do that. I've been told many times that why should we do this when the surrounding counties are not doing what they need to do to stop the virus? Well, that may well be true, but if we all take personal responsibility for protecting ourselves by wearing a mask, it doesn't matter where the vectors come from. Whether they're in Nashville or other places, we can slow down the virus by protecting ourselves by wearing these things. And by doing that, the good news is we protect each other. So I know we're tired, I know we're weary, but we can't give up the fight against the virus because the virus is not going anywhere. And despite what you might heard, it's not going to disappear. It's not going to magically go away. The only time the virus is going to stop is when herd immunity has been achieved. And that's going to come with the vaccine. So Nashville, we got this. Let's keep doing what we've been doing. And as a reminder, another viral foe is upon us right now, flu. And having both viruses in circulation could be a really challenging thing. So please, if you haven't done so, get a flu shot and help us fight these two viruses together. Thank you. And now I'd like to introduce Andrew Clancey, founder of Any Old Iron.
Hi all, my name is Andrew Clancey and I'm the fashion designer behind the label Any Old Iron. I would like to thank Mayor Cooper for giving me the opportunity to speak on behalf of the fashion community of Nashville. I would also like to thank him for recognising the importance of helping locally owned small businesses stay open. We are excited to be opening our new store next month on Music Row. We as a city have to keep moving forward. We need those numbers down so you all can come visit. Please keep that social distancing up and also wear your masks. Or even better, wear our masks. Back in March, when there were 100 cases, we pivoted from making sequin suits to sequin masks and have helped thousands of people with their social distancing. Wearing a mask doesn't have to be a chore. Thank you, Mayor Cooper, Metro Public Health and the NVCC for working together to support Nashville local businesses. Nashville, please remember, stay safe and stay fashionable. I now welcome Tasha Kennard from the Director of the Nashville Farmers Market.
Good morning. Thank you, Andrew. And thank you, Mayor Cooper, and everyone serving on the COVID task force for your leadership and ongoing work to ensure that our community has access to information, resources, and test centers. And thank you to all the small businesses, including you, Andrew, who are doing your part every single day to make sure that our community can safely reopen. The Nashville Farmers Market is open for business, and we continue to operate daily with enhanced cleaning and safety protocols, social distancing, and limited indoor and outdoor seating. We're also working to increase access to fresh, healthy food for everyone in our community. We have partnered with Metro Nashville Government and Second Harvest Food Bank to distribute vouchers to provide access to fresh, healthy food for people impacted by COVID-19. If you're struggling to meet your grocery needs and you need access to this voucher program, we encourage you to contact Second Harvest Food Bank of Middle Tennessee today to ask about the voucher program. You can bring those vouchers directly to the farmers and artisans at the Nashville Farmers Market and receive food assistance during the holiday season. We're also matching dollar for dollar all purchases at the Nashville Farmers Market for individuals using the EBT program. This helps you double your purchasing power during this very, very difficult time in our economy. Both of these programs not only provide nutritious food to people in need, but they're also offering a lifeline to small family farms and artisan vendors operating in farmers markets across our community. We understand that this is a challenging economic environment, and we need everyone to do their part. Wear your mask, practice social distancing, and always remember to shop local. As we celebrate this Halloween weekend in our neighborhoods across our city and enter into the holiday season, it's very important that we remember to support our local businesses that make up the fabric of our community. So while you're wearing your mask and your social distancing, stop by your local farmers market, including the Nashville Farmers Market, and support hundreds of local farmers, artisans, restaurateurs, small businesses, musicians, and artists. They need your support now more than ever, and we can do this, Nashville. We can make sure that every dollar we spend in our community supports local jobs and local businesses in a safe and healthy way. Thank you.
Thank you, Tasha. We'll now begin taking media questions first with Nancy Amons with Channel 4.
Hi, thank you. Thank you for taking our calls as always. I have questions for Dr. Hildreth and for Dr. Jahangir. Can Dr. Jahangir please review again the Nashville hospital capacity and what his take is on that? What are they doing to free up beds as necessary? And how concerned is he about that capacity? A couple of questions for Dr. Hildreth that come from viewers. One is, can people receive, when the vaccine's available, can people receive more than one vaccine? If one vaccine doesn't cover, maybe only covers 50%, will a second vaccine from a different manufacturer help boost what the first one misses? I'm also interested in how long will the immunity last from the vaccine? We know that immunity when you have COVID itself is fairly short-lived. How long will the immunity last from the vaccine itself? Thanks.
We'll start with Dr. Jahangir.
Sure. Thank you, Nancy, for that question. To review the numbers for hospitalizations, there are currently 199 individuals who are hospitalized in Nashville hospitals with COVID-19. That is the highest the number's been since July 23rd, but if I've followed these numbers pretty closely, and I'll tell you, it has been high, but stable at this high level for the past week or so. So we're bounced between 190s, 180s, and today, again, just 199. Our capacity availability of hospital beds in Middle Tennessee is 13%, Davidson County 6%, and ICU capacity is 13% in Middle Tennessee, 12% Davidson County. Now, I'll tell you this, the Nashville hospitals, so the three major systems we have in Nashville General, have stepped up very strongly. I know I've spoken with the leadership of all three of those of the medical centers pretty regularly. They are doing things to try to control capacity, and that means sometimes they'll double up beds. They have surge capacity plans they've implemented. But as of right now, there's no plans, to my knowledge, of any diversion of cases or anything to that in our hospitals, because elective procedures are only really so elective. I think people need to remember that. There are other hospitals around our region, Murray County, Williamson Medical Center, that have had to delay elective surgery. And I think, as the mayor pointed out, and the Vanderbilt study confirmed, counties that don't have mask mandates are seeing a lot more hospitalizations. And so we're fortunate to be in a city that has a lot of hospital capacity, and people are doing what they need to do. Your question of am I worried? I think by nature of who I am and what I do, I'm always worried. But I also have a lot of confidence in the leaders we have in our city hospital systems to know they're on top of this so strongly, and in addition to that, the partnership with the state that they have. So we're worried. We're doing all the things that we know how to do. And we'll continue monitoring that. Thank you.
Nancy, the question about getting multiple vaccines, it would not be advisable for a person to get more than one of these vaccines unless a study had been done to prove that getting 2 vaccines was safe. We know that people are getting reinfected in as little as a month after the first infection, which tells us that the immunity you get from a natural infection is not long-lasting. But the vaccines are designed with something called adjuvants. Adjuvants get the attention of the innate immune system, while the vaccine itself is getting the attention of the adaptive immune system. And the combination of an innate immune response and an adaptive immune response means that vaccines can achieve durable immunity when the virus itself may not be, because it's designed to do so. But I would not advise people to get 2 vaccines, 2 experimental vaccines, even if they're proven safe and approved by the FDA, until we know that there are no interactions between them that might do harm. That would be my recommendation.
Our next question comes from Brett Kelman at the Tennessean. Go ahead, Brett.
Morning, everyone. This question is primarily for Mayor Cooper and Dr. Jahangir. Does the hospitalization situation, particularly in Davidson County, warrant the opening of the alternative care site at Nashville General Hospital? And if not yet, how close are we to the threshold where that is necessary?
Well, thank you, Brett. Let me just defer to Dr. Jahangir on this, who I know who's in contact with both the state and the hospitals on a daily basis. Thank you, Doctor.
Sure. Thank you, Brett. Again, the current hospital system, the hospital systems currently are able to tolerate the load. I know that that I, along with the hospital leadership, communicate regularly with Dr. McDonald at the state. I know Dr. Piercy, I believe, at her press conference yesterday mentioned I believe she said there's no clear metric per se, but there's daily conversations as to when they would open it. The big issue there also is staffing. Nashville General is ready to go if and when the hospital systems, along with the state, feel that we need to open it, and staffing would need to happen. So still, I can't give you a clear metric as to when that would happen, but as things stand today, hospitals are able to take care of our patients, both who have COVID and also those who don't have COVID. I mean, I think you have to remember that we focus on this one disease, but everything else out there still needs to be taken care of. So stay tuned. Thanks.
Our next question is from Dennis Ferrier at Fox 17. Go ahead, Dennis.
Thanks, Brian. I believe you said Dr. Battle was there to answer questions as well, if I heard right. So I do have a question for her as well as Mayor Cooper. My question for Dr. Battle is, who exactly, by name, are the health officials advising you, your direct advisors that drove the decision to remain virtual? That is a question a lot of people are asking, a lot of viewers, as Nancy Amons mentioned. And for Mayor Cooper, you've consistently and unfailingly said weekly that you're following the advice of your health professionals, which is understandable. Yet your health officials were in favor of giving the Titans a larger percentage of fans in the stadium. It was a plan approved by the NFL, the CDC, and your own health department, at least preliminarily. Why did you overrule them? Thank you both.
Dr. Battle.
Yes, thank you for your question. I'll just remind us, several months ago, I stood before you as well as many other educational professionals across the city, alongside many of our local health experts, to devise and release what we call the Nashville Plan. And that task force came together to create our guiding document by which we will make determinations and what metrics we would use to determine our reopening of schools and any phase-in plans. Again, several of our medical doctors and public health specialists have been a part of that planning framework. Dr. Jahangir and the staff at the Metro Health Department have helped to answer questions and provide critical information for us as we've progressed through this particular school year when we've needed it. However, they have left the decisions with regards to opening and phase-in plans to the respective school districts or systems, including Metro Nashville Public Schools, our charter schools, and local private schools. Decisions are based on many factors, public health and safety being at the forefront, but also the academic factors that we have gleaned from all of our stakeholders, our employees, our parents, our students, and including our Board of Education. As a reminder, Metro Nashville Public Schools we contract with the Metro Health Department to provide nurses in our schools. Our nurses in each of our schools are the initial contact for investigating any potential cases, for identifying who needs to self-isolate and or quarantine. They typically make a recommendation to us as well with regards to classroom closures and school closures, but the ultimate decision at that level with regards to school closures and classroom closures are left up to the district.
Thank you, Dr. Battle. And Dennis, thank you for that question. You know, the Titans opened up, they had a marvelous plan which public health looked at in detail and approved. And I think everybody in Nashville, when you look at the games on Sunday, it feels like we're getting it right on a national basis. That's a great thing. We're not with no fans, we're with fans. It seems to me when I look at TV, we probably have almost more fans than anybody. And what gives me confidence in that decision is I know they work so closely with our public health department. And when I've been at the site and the games, I have felt safe. The incredible staff at Nissan Stadium makes you feel safe. We don't detect any transmission at that sporting event. Of course, we're always going to be vigilant about it. And I think it ends up being a model for showing that we can get back to normal. We have to be careful about how we do it, but we can do it, and we're demonstrating on with a national prominence that we're able to do it here in Nashville. Thank you.
Thank you. Up next is Julia Palazzo with Channel 2. Julia.
Good morning, Brian. Thank you. I have a few questions. Mayor Cooper, we're talking about our numbers not improving, going back to peaks that we were seeing in June and July. So why not move back or modify phase 3? I know we did some modifications fairly quickly when we started seeing these peaks over the summer. So now, is there a specific number or circumstance where we decide it has to be more than just saying we need to wear masks and social distance? A second question for Dr. Battle. We were talking about in the beginning of the press conference about some of the spread of the virus among school-aged kids through sports. Why continue to have sports and take that chance at all if we're trying to stop the spread of the virus? And a third question for Dr. Caldwell. Acme Feed and Seed closed down this week. They released a statement saying that they have seen a lack of enforcement and are very concerned about that. Are there less officers present on Lower Broadway and throughout the city? How has enforcement been going? Thank you so much.
We'll start with Mayor Cooper.
Thank you, Julia. I'll go first. On the question about phase 3, and are there any changes? A marvelous thing has happened this week. It's our neighboring counties have adopted a mask ordinance. So the hundreds of thousands of people that come into Nashville every day from other counties, they are being safe at home. And we feel, as I was saying in my remarks, it takes a disease cycle to begin to see the benefit of that. With our region adopting a better mask standard, we hope to see the benefits of that. We worry, of course, that we won't, but it's our best tool. It's been proven here and around the country that it works. Now that you've got a regional adoption of this standard, I think you've got to look to that. We're deploying our best tool in a better way. We are dealing with the spike in this way, and then lets us all remind ourselves that it doesn't stop at the door or at the county line. Home spread is a concern, and again, Dr. Hildreth was reminding us, we all have our inner family bubbles, but when you're not right in that bubble, wearing a mask is clearly going to be effective. Thank you, Julia.
With regards to the question for Metro Nashville Public Schools extracurricular activities, particularly sports, we do continue to monitor this particular area. What we're trying to accomplish this year, which is very complex and unique from previous school years, is being able to offer a continuity of learning and experiences and opportunities for all of our students, both academically and with extracurricular activities. We have and will continue to make adjustments as we close out our fall sports season and enter into our winter sports season. What we've been able to track internally is very low to no transmission within our school buildings and within our teams. But again, we are closely monitoring this. And what we know and what the researchers and the experts have told us is that low community spread is significant. It's critical to our ability to continue to provide these opportunities for our students. And so we continue to closely monitor and will adjust our plans as needed.
And Julia, as the mayor, let me answer the third part of the question here. First, I want to celebrate everybody that is doing such a great job in Nashville. If you routinely go out, boy, our businesses and our restaurants are being amazing and making people feel safe. I want to draw attention to the Vanderbilt study, which confirms that it's the disease level in the community that is restricting spending patterns. And so the best way of getting the economy restarted is to drive the disease level down, and so that people know that they are safe. Now, everybody needs a little bit of reminding, and we're willing to do that here, and I'm grateful to every part of Metro government that is working so hard to keep us safe. 15,000 Metro staff hours have gone into enforcing public health measures. I mean, that sounds like a lot, but this is the disease of a century. This is the greatest health crisis that our city will have in my lifetime. Our current health enforcement team, Metro Health, Metro Police, Beer Board, Transportation Licensing, Fire Marshal, and Codes, they have been hard at work and issued 234 citations for mask violations, including 20 arrests, and that would be kind of aggravated non-compliance. The health department has made 2,600 compliance visits to businesses and issued 77 civil warrants. Most have made their way through the courts with fines assessed. The health has closed 36 establishments. And I think we all know from our experience in life, there's always often going to be somebody, but it's important in the pandemic that everybody follow the rules and we get through this together. The Beer Board has suspended permits of several establishments for violations. The Transportation Licensing Commission has issued citations, and the police precincts are checking for compliance, mostly closure times, while on patrol. But it's the hard work of a lot of people in Metro that are allowing Davidson County to go from worst first in the state to really a number in the 60s. Our density, we have a lot of areas, hospitals, prisons, nursing homes, where disease spread would be terrible, but also rapid. We have a higher risk profile as a county, so to speak, but with that, we've been able to manage the disease here, and that's with the effort of everybody. So again, thank you, Julia, for the question, and I wanted to give you kind of a full response of what we're doing to help you stay safe here in Nashville.
Our next question comes from Stacy Case at Fox 17. Good morning, Stacy.
Thank you, Brian. With many businesses still partially shut down, I'll disclose this.
Your phone. Let's see, let's go with Harriet Wallace at Fox 17.
Yes, good morning. Thank you so much for calling on me. I've got just a few questions. The first is for Mayor Cooper. What conversations have you had? Can you hear me okay, Brian?
And that is
what, Mayor Cooper, what conversations are you having with state leadership with regards to support statewide? First, nursing homes have shown from the White House is a great area of concern. There's reports showing that they do not have enough PPE. I know that, as we discussed last week, they are regulated by the state, but these nursing homes are in the Nashville area. So what conversations are you having with state leadership on getting support for nursing homes in the metro area? My second question is, you all did speak a little bit to, not modifying the phase we're in, but if you could speak to, because everybody wants to know, it's looming, it's a worry, what metrics, what would it take for you all to consider modifying or maybe rolling back reopening? What can we look for to know when that may be coming? And my last question is specifically for the health department. I have received numerous calls, and Brian, you and I had some communication about it. There are multiple employees at, for example, AT&T, Calvary Logistics, and some other companies who say that their employees are not doing what they're supposed to do in terms of stopping the virus, 6 feet distancing, all of that. How are you all handling companies like this or reports like this where people may be afraid to speak out, but they're also afraid to lose their job and are worried that they're getting sick? Thank you.
Thank you.
Well, thank you, Harriet, for that question. To answer your question about conversations, I talked to the governor yesterday, and, I'm grateful that their governor and the state is strongly encouraging counties to have mask ordinances. I'm grateful to the mayors that have moved on that. I'm grateful that Nashville moved on that a long time ago. There is a concern, I know, and I'm sure the state shares that too, is the lack of a second CARES bill coming from Washington. All year long it has been promised, and here we are at the end of October, and there is no clear path for that. Assistance to our small businesses and to PPE and for our nursing homes would clearly indicate the need for that. And going forward, I think everybody in the state, if you're seeing a federal legislator, remind them their work is not over and we need the Federal CARES Act. We're still, unfortunately, operating under the old rules, the December 30th termination of the original CARES Act. It has not formally been changed. But I know the governor and I know that small business has been hurt and that our ability to provide adequate PPE for our vulnerable populations is a question. I mean, we're all puzzled why it's taking so long for clarity with the CARES Act. Again, thank you for those questions. The general concern of rolling back, let's get the mask mandate complied with, adopted, and people doing that. That's the answer to concerns in going forward. This is our path going forward, is people learning how to be safe. And we know we can be. We just have to get over our virus fatigue and stay on course. Thank you.
Good morning, Harriet. We encourage everyone to learn how they can communicate with the health department regarding any concerns that they may have at any time. If they see somebody that they feel is not following the guidelines, if they feel unsafe, go to our COVID19.nashville.gov website. Scroll down just a little bit and you could submit a complaint. You could also call 311. You could go to Hub Nashville. You could reach out to the health department directly. You could reach out to me directly. We are in touch with the community on a daily basis. We address these concerns and complaints all the time. And we want to make sure that we hear from all of you because we cannot be everywhere all the time. So if we are not alerted to there being a problem, it's hard for us to know about it or to do anything about it. So whether it's face masks, non-compliance, or social distancing, or you don't feel safe at work, you should feel safe at work. We want to know about it. I want to know about it. Please let us know. We'll keep you anonymous, but we all need to work together. Our expectation is that management and leadership of every business, mostly all the time, they should want to keep their workers safe. They want to keep their customers safe. And if they need to help, we need to help them, educate them, or work with them. We will do that. Thank you, Harriet.
Okay, we're going to try Stacy Case again with Fox 17. Stacy.
Okay, thank you so much. I appreciate it. This question's for the mayor. With many businesses still partially shut down to slow the spread.
We'll try to connect. Well, let's go ahead and go to Yoon Jong at the Tennessean. Yoon.
Hi, good morning. Questions for Mayor Cooper on the search for Nashville's next police chief. What key factors will play into the decision? Will the interview panel submit a recommendation and be scoring each candidate? And on what day should we expect a decision from him? Thank you.
Much better.
I don't know that I understood.
Yehan, if you could repeat that. I know it's a question about our police search, but we couldn't quite hear the details.
All right. My three questions are, what key factors will play in the decision? Will the interview panel submit a recommendation and be scoring each candidate? And on what day should we expect the decision from you? Thank you.
Well, I've been super, I mean, it's gone. I want to be grateful to the community, the more than 1,000 respondents to the online poll. And then I think we have a path for sharing each of the candidates' Q&A with Dwight Lewis later today, broadcasting on Channel 3. And then the large number of people, both formally and informally, who have benefited me with their advice. I want to thank the Policing Commission for their hard work and being part of this interviewing process, which really represents a very widespread cross-section of all of Nashville. I think some of the things that people in Nashville have indicated are extremely important is a chief that leads with their heart, a chief that's good at communications and good at partnering with the community for community solutions and serving those communities. Now, it's a big job, and there's got to be management capability so that the department is administered at the highest level of professional standards. These are the kind of things that I think all of us in Nashville will be listening for as these candidates come together. I'm not, having been through this process before, I'm not sure what the interview panel is going to be providing specifically in terms of inputs with me. I know I will want to spend time with each person participating in the search, and also I'm encourage people in Hub Nashville to email me their impressions when they see the interviews on television. The decision, I don't know, but will be relatively soon once all the information is in. It's going to take some time for me to be in touch with everybody that is participating in this process to hear from them individually their feelings. And I think it's an exciting time for Nashville to adapt into a kind of a 21st century look at policing, and all the discussions that have gone on are an excellent foundation for the new chief to take the level of discussion and concern as what they're being hired to do here in Nashville. It's a great moment to have both the job description and the personnel hopefully match, and to have a great path going forward for the city. But thank you, Yehan. I think today a lot of those interviews are taking place, and then tomorrow I know I'll be seeing all 5 candidates.
Our last question comes from Blake Farmer. Go ahead, Blake.
Thanks. I wanted to, I think it's really a question for Dr. Battle. We're seeing, I know it's far away, but in Europe, you've got a couple of countries who are looking at and are closing down, restaurants, bars, gyms, that sort of thing, and in an effort to try to make sure schools can remain open. And Dr. Battle, I know you heard a lot from your school board, some frustration that the city was not looking at doing just that kind of thing. Would you recommend that the city do everything it can to close anything else before you might have to close schools again?
Thank you for that question. Now, what we know, particular to those areas, is that their case counts are much lower than Nashville. And it's important that we keep a local eye, our local context relevant to our decisions with regards to the opening of our school system. We are prioritizing, to the best of our ability, getting our students back in school. We know that there's not a replacement for the face-to-face learning experience for all of our students. Yet we've also provided options for our families based upon their needs and the safety measures they're putting in place to protect their students and their families. So right now, our students are in a combination of virtual and in-person options. And we want to continue to provide that option to all of our families, all of our students who desire to learn in the in-person environment. Our commitment has remained the same. As I mentioned earlier, part of the approach to developing the Nashville Plan was to ensure that we had guidelines, key metrics that we will be following in alignment to our health experts to make informed decisions to providing the best quality experience to our students as we navigate this pandemic. And so our commitment has remained the same in that space. We continue to work closely with the health department, with the mayor's office, who is also helping us prioritize what's needed for us to keep our schools in session. The plea here is our community spread matters, our case counts matter, and our ability to be able to keep our school buildings open. Right now, we've prioritized our exceptional education students who have been back in session in the in-person environment at their choosing since Labor Day. And since fall break, we've prioritized that option for our youngest learners in pre-K through 4th grade. And so we'll continue with our communications, and our stance is we're going to do what's necessary and encourage all of Nashville to do what it takes in order for us to be able to get our students back in school and to have that continuity of learning learning experience as we move forward. But I'm very thankful for the partnership with our local health department and our mayor's office and working closely with us, and we'll continue to be innovative and really strategize around what it's going to take for us to continue our phase-in process as we move forward.
Those are all the questions we have this morning. I'd like to thank Andrew Clancey and Tasha Kennard for joining us today. As always, we're grateful to Amy Lankite and our partners at Bridges for the Deaf and Hard of Hearing for providing the ASL translation at these press briefings. The next Metro COVID-19 press briefing will air on Thursday, November 5th at 9:30. Thank you for joining us, and that concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.